This particular program is an example of how Howard County proactively adjusts and innovates to ensure the highest quality and most cost-effective outcomes for its most vulnerable and sickest residents, even amid the changing healthcare landscape. And in this case, we're looking at those super utilizers of hospital care. This program combines new concepts such as hotspotting, which Paul mentioned, with old-fashioned public health outreach and case management. Using existing and real-time data to identify high utilizers of healthcare, the community health workers will provide social supports necessary to optimize the patient's outcomes and keep them from unnecessarily being readmitted to the hospital. Once identified, the high utilizers will be engaged by our community health workers, and that happens in the hospital at the bedside as real time as possible. And they, with consent, are enrolled. The community health worker who's assigned to the individual helps them access more impactful, effective, and efficient medical services, trying to reduce those barriers to care, which can be anything from transportation to understanding the new medication regime they have or the new diet that the doctor and nurse have recommended, to promoting health factors like getting exercise, going to Centennial Park with your dog, or getting a dog, since we know therapy dogs can be helpful in optimizing health. They'll help the clients navigate the healthcare system, which is not easy to navigate, and help bridge the transition between the hospital and the primary care providers. And we are working with primary care providers within the community to help become medical homes for these patients. Ultimately, this project will result in better outcomes for those enrolled, reduced hospital readmissions, and lower costs of care as healthcare expenditures shift from inpatient and emergency room visits to community-based primary care providings. We hope that the shared savings can be reallocated to services that benefit the entire Howard County community to promote healthy lifestyles, reduce health disparities, and decrease the burden of chronic disease. These long-term benefits will enable Howard County to continue its reputation as the healthiest county in Maryland for many years to come.